Great. All right, so as we said, this is about creating your post-pandemic mental health toolkit, and we will just dive right in. So first thing we want to do is know a little bit about who you are and how you are. So you should see on your screen a nice Zoom poll, and we will ask you to go ahead and fill that out, please.
And for those who endorse other, if you don't mind, please feel free to use the chat function to type in what those other strategies and hobbies have been.
Looks like we're getting a great mix of different strategies people are finding useful. So we're seeing lots of watching things, listening to music, walking, Zoom meetings and trainings. Hopefully those aren't just work related if they're being used as coping strategies, right? Okay, great. So important that we all take note of what's been sustaining us and what's helpful, and pay attention if we need to do a little more of that. Our own mental health is really critical, and if we're going to be attending to the mental health of others. Luckily, spring is here, so outdoor activities hopefully can continue and increase in this good weather. Good. All right. Do we want to launch our next poll? So we are really interested in understanding where you hail from and what you do. So this is 2 questions on this poll.
Yes, please be sure to scroll down. And again, for those who are endorsing other, please indicate what type of institution you're with, and if you're endorsing other for your role, please include that as well in the chat. Thank you.
All right.
All right, we'll give folks maybe five or six more seconds to share with us, and then I'll end this poll.
All right. So if, yes, this has been very useful for me, because if I had predicted who our audience would be, I'm not sure I would have been able to predict accurately. So we're really glad to have you, and this will help us target our discussion to meet your needs and address the folks who you serve primarily.
Right. This next poll that we have coming up, we want to know how you're doing on a scale of 1 to 10, 1 being not very well, 10 being that you are absolutely rocking. We'd also like to know how the students or youth or emerging adults you're serving, how they're doing, and also how do you feel your colleagues and coworkers are doing. So this is actually a 3-parter. So please be sure to scroll down all the way.
So it looks like we're seeing, not surprisingly, people in that kind of middle range. It's shifted a little bit as people have answered. 6 was the high earlier. Now we've got more at 7. But ranging from 3 to 10, actually, with the bulk of you in that 6, 7 range. And my suspicion is that that varies and has changed over the course of this last year, but helpful sometimes to reflect on how you are in any given point in time, especially connect it to the things that seem to help you cope. I don't know, Melissa, you want to add anything about the self-assessment?
No, I agree. I imagine the self-assessment might vary from day to day or maybe even hour to hour, depending on who you might be meeting with or what task you might be asked to undertake, or even what the news says that day.
Right. Definitely looks like you're concerned about how your students are doing and seeing that they're having some challenges, little bit overall, a little bit lower, similar bell curve, seeing kind of that 4, 5, 6 range as opposed to 6-7. So hopefully we'll be able to help you think of ways that you can support them actively, especially at that post-secondary level. So Melissa will be able to share some ideas and help you think that through, I think. And colleagues as well. So colleagues seem to be doing about the same as we're doing. We're thinking that they're maybe struggling a little bit more. So that high of 5-6 as opposed to 6-7 when we rated ourselves. And thinking about how we can also be supportive to them as a part of meeting the mental health needs that have been uncovered or revealed by the events of the last year. Okay, and in thinking, I don't know, Melissa, you want to say anything else? Okay, in thinking about our how we're going to spend our time this afternoon, we want you to just think for a minute about where you really need help in moving forward as you're thinking about meeting the mental health needs of students and staff. Is it coming up with ideas about what you should be doing? Is it figuring out what resources are out there to help you meet needs? Is it creating a plan, figuring out what data you have or should be getting? Is it implementing a plan, or have you started things but you're worried about sustaining them? Or again, something else. And if it's an other of some kind, feel free to drop that in the chat. And hopefully the activity that we have planned for your breakout will help you get to this a bit, but it's kind of nice sometimes to think, where do you really have your need, and will help us help you think this through. So far, lots of people wanting to figure out resources and just getting some new ideas.
And if there's something other than one of these, again, please include it in the chat to help guide us.
Okay.
Sure, I'll be happy to repeat the question. If anybody has an other need that they would like to make us aware of or make the group aware of, please type that in the chat. So even if your main focus is resources, but there's something else that is on your mind that you have as a need, please go ahead and include that in the chat. Okay, we'll give it about 10 more seconds.
So one thing I just want to say, in case we forget to say this later, is that even though implementation and maintaining, sustaining aren't necessarily the primary focus right now, I just want to remind everybody that as you're thinking about what you want to be doing and thinking about resources, that you always want to be thinking about that with an eye towards implementation and maintaining and sustaining, right? Because you want to be finding things that you will be able to actually use and that you'll be able to sustain using. So it is all kind of tied together. I think there's a little bit of a false difference and distinction between some of these things. They all overlap, but just in case we forget to say that later, always like to put that plug for implementation starts from the very beginning, and sustainability starts from the very beginning, as you guys probably know. All right. So I think that's the end of our polling. Is that correct? Great. All right. I'm going to remove the poll for me, and let's get rid of the chat so it's not in the way. All right. So the guiding questions that you were given when you chose this was a variation. We adapted it slightly, but hopefully we're going to address two big things. How do we address student, faculty, staff? And I think that actually I meant to say family there. I just noticed the typo. Student, family, faculty, and staff. Mental health responses related to COVID-19 and other events of this past year. And how do we enhance or continue to enhance our ability to provide those mental health supports and services, and to address those resource issues that may even predate what started to happen a year ago, but certainly have been enhanced. So when we think about resources and we're thinking about what can we enhance and maybe what do we need to start from scratch with, as well as innovations. And then, I think as Melissa and Beth and I have talked about this, what we really know is sometimes hard is that we can spend a lot of time thinking and planning and doing resource mapping or doing needs assessments, but really we know that kids and students and emerging adults and our colleagues are suffering. And so we don't want to get into a cycle of just planning and planning. We really want to start ramping up the supports and services to meet those needs pretty quickly. So we hope, as we said, that will be the outcome of this, that you'll have some tangible things that you can take with you. And based on the fact that that the bulk of you are in a post-secondary world, I'm going to actually let Melissa really kind of be the lead, because that is her world much more than mine. And so we'll really try to focus on that. So just to start out, we don't want to spend a lot of time telling you what you already know, but here are the assumptions that we're operating on, that we all agree that this last year has had a deleterious effect for a lot of people on our mental health and well-being. And what's strange about this year is that in some ways, some of us may feel like we're doing some good things to take care of ourselves, and we've gotten better at that, and also that the struggles are very real and the challenges are very real. For our students and young adults and emerging adults, that challenge can be really daunting, because they're supposed to be figuring that kind of stuff out now under normal circumstances. So the added challenges and stresses of the last year have been enormous for them, as you well know. So that's our assumption. And so we also are going to assume that the adults who are working in all of your institutions and agencies and schools are also facing those same kinds of stressors and challenges and have had some adverse impact from that. We also can assume that some of the ways that we normally cope with stress haven't been as available to us because of social distancing and not being able to travel and not being able to go to gyms and not being able to gather in community, not being able to grieve in community. All of the ways that we normally get supports have changed. For some of us, we've been able to find alternative ways. For others, that struggle has been harder. And that the other assumption that we are operating on is that for folks who have had pre-existing mental health issues, so whether that's an affective issue of depression or anxiety, whether it's a post-traumatic stress disorder or a history of trauma or grief or loss, whether that is something more in the area of psychosis or something like that, that these adversities have weighed heavier. The adversities of the last year have also been harder on folks who already were suffering from disproportional access or limited access to resources, to healthcare, to financial supports, for our essential workers, for folks who were living in communities that were under-resourced and disenfranchised, et cetera. So we know that, and there's plenty of data that can support that, and we're not going to go through that, but when you get the slides, you'll be able to click on these links. And these are some of the resources that I think are pretty good and pretty current that can back up that, including the first resource, which is more focused on secondary level students, but the student-to-student survey that the Kentucky Student Voice team did. And you may have heard about that yesterday if you were in yesterday's session with them. I think they probably talked about that. And a couple of other things around teachers' mental health and well-being and disparities, and the connections between disparities, racism, and mental health and well-being. So certainly this is all part of the package. So that's our assumption and our starting place. Melissa, anything you want to add?
Sure. Some recent data that have come out from the Center for Collegiate Mental Health within the last month highlights that across 37 of 38 demographic identities, mental health has been reported as the #1 impact of COVID for college students. Specifically, these are students who are already using their university or college counseling center. But this is a robust data set of over 47,000 college students who are using their school or university counseling center during fall of 2020, and represents over 140 institutions. We're talking about demographics based on academic status, race and ethnicity, gender identity, sexual orientation, international status, being a first-gen college student, an athlete, having a disability, or being a veteran or having been engaged in military service. The one demographic area that did not report mental health as being the top area of impact was among African-American students. And it was a 2% difference. They reported focus and motivation being the most impacted at 58% and mental health at 56%. And when you think about a lot of the other contextual pieces, including race-based murders, it makes a whole lot of sense that focus and motivation would be a lot more difficult.
And probably connected to mental health and well-being. I mean, it's all connected in certain
Absolutely.
ways. Okay. Oops, sorry, we just went backwards. Okay. So this idea of building a toolkit for you. And I think we've made the case for why we think that's important and what we hope to do. So we want to spend a few minutes just identifying what some of the challenges may be for you. And I'm going to let Melissa take the lead on this so she can connect it to the post-secondary world.
Absolutely. I mean, some of the challenges that we're facing, certainly when we've been working remotely and virtually, is dealing with the physical isolation that students have dealt with at all levels. And when we think about the college or university experience, part of that experience, part of why students attend college or university in person is to connect, is to make friends, is to find dating partners, is to be around other people. And when we think about the physical isolation that has gone along with that, we have had students, especially those who might already feel isolated based on some of their identities, being even more isolated. We had a lot of LGBTQ students who a year ago were leaving campuses where they felt supported, where they were being addressed by names and pronouns that were congruent for them, where they were able to talk about dating partners that were congruent for them, and returning to environments in which there was not much that felt affirming or congruent, where they were having to go back into a closet and figure out how to survive in that environment indefinitely as the pandemic has gone on. For students who have remained on campus, but have tested positive for COVID and have had to deal with being in medical isolation, or students who have been exposed and have been in quarantine, dealing with connection has been a huge, huge challenge. Thinking about the data that we have and the data that we need, and trying to ascertain what students need, what do staff need. Certainly, we have a good sense of who our students are, how we're serving them, and not having those same connections, connecting through a screen fewer hours a week rather than the natural orbit that we have running into people in hallways, walking across campus. For those who are not in post-secondary, during break times, class changes, things like that, not having those informal contacts does make it more difficult to understand what students are needing. And when we think about these challenges, and we have pages of them, it can feel like we're drinking from a fire hose, trying to take in all of this information, trying to ascertain what we're missing as a way to best meet the needs of the students as well as their families, our colleagues that we're doing our best to serve. Next slide, please. Some additional challenges that we face are within ourselves as well. Our self-awareness. How do I know if what I'm dealing with is anxiety or depression, or is this the COVID new normal that we've been talking about? What is normal in these circumstances? When I think back to a year ago, I was ready to go to sleep and call it a day at like 6 o'clock in the afternoon. I don't know if anyone else went through that, but man, I was more tired than I'd ever been, except maybe when I had mono in grad school. That's a different thing. But having that self-awareness, how much am I adjusting to? Is this normal adjustment, or is this the beginning of a more prominent, possibly more significant mental health concern? And then, and that's just for ourselves. And then when we're looking at and thinking about the students that we're serving at all levels, we've got that fear, that voice in the back of our heads, that app that sometimes won't close. What if I do the wrong thing or I make it worse? I'm seeing my students suffer. And what if I do the wrong thing? What if I say the wrong thing? What if I miss something and don't act at all? Or what if my actions make it worse? What if I am adding gas to a fire? And on top of that, we're still trying to take care of ourselves. And for many of us, not only taking care of ourselves, but taking care of loved ones, maybe taking care of loved ones that we haven't had to take care of or take care of differently than we have in the past. And all of these are the background upon which we are serving students, that we are going to work every day, whether it's logging on or unlocking a door and going in person. These are all of the apps that never quite close for us. These are all of the apps that start to drain our batteries in 100 different ways and make everything that we do just a little bit more difficult, and at the same time, even a little bit more meaningful, because everybody else is struggling with these same things. Next slide, please. And so on top of all of this, when we are engaged in the work, one of the things that we wrestle with, especially those of us who aren't mental health providers, who aren't licensed mental health providers, where are the boundaries? Where is the boundary between caring and providing care and providing mental health service? And that can be difficult to discern, depending on the day, depending on the student, depending on the circumstance. And even when we're in person, we tend to have more of a sense of what resources are available. And yet, when we're working remotely, it can be a lot more difficult to know what's available, to know what is changing, to know what services are evolving, or sometimes what services are going away. I know many of us have dealt with, at all levels, have dealt with budget cuts, have dealt with furloughs, have dealt with position changes or cuts, and trying to keep up with what is still available, how to access it, how to help the students we're serving access it, whether it's an emerging adult and helping them figure out how to get those resources, or working with a younger person who might have to depend on a caregiver to get them connected with those resources as well. That also goes along with limited service, especially in areas that are less densely populated, that might be more rural, that might have a large service area served by a very small group of providers, whether they're in the school, or in the larger institution, or in the community. And as Miriam mentioned earlier, one of the things that can stop us from doing anything is this fear of getting started, not feeling ready enough, needing more time. What if we make things worse? I can tell you, in the higher ed realm, most university and college counseling centers were not providing telehealth services. Most of us weren't doing it. There was guidance emerging on how to do it, but most of us were not doing it for a lot of reasons. Being worried about how it might look. What do we do? What if I have a student that, is laying in their bed for a therapy appointment? And for a lot of us, there was a fear of getting started. And yet when the time came, we just had to get started and figure it out along the way. I know this is an analogy that's been used, probably overused. And so I'm going to add to the overuse by saying it one more time. But all of us in all of the positions that we have been in the position of needing to fly the plane, build the plane, and sometimes even provide cabin refreshments all at the same time, while also doing security and baggage handling. And if you're feeling tired, if you're feeling overwhelmed, if you're feeling incredibly challenged, even after a year of navigating all of this, it's okay that you're feeling challenged, because these are new challenges. We are trying to navigate and build and clear the path forward. And hopefully by attending this forum, by attending this session in particular, when we transition to the breakout rooms, hopefully you all will recognize that we can clear this path, we can build this path together. And sometimes we're not always sure what the path is leading to, but we know what some of the steps are along the way. We know student well-being is going to be a part of that. We know that communication with families at all levels. We know that continuing to look out for one another, for our colleagues, for our peers, all of those are going to be a part of it. And the only way we can make it happen is by actually just getting started. And the plan for today is to be that step you might need, regardless of what level it is, if it's data gathering, if it's goal setting, but helping you to get started. Or if you're already well on that path, helping you to maintain it. All right, so I'm going to turn it back to Miriam.
Okay, so one of the things that we thought would be useful for you to do, and we'll ask you to think about that now, and then in your breakout rooms, you'll have some time to actually jot some notes down, but to really think about the resources and to think about them in these two ways, so that you end up with 4 quadrants, right? So we always want to think about what you already have, what you need to secure, what you know about, what you wish you had or need to look for in your community, in your community. And when we think about community, we really want you to think both within the organization, because probably there are some additional resources within your organizations on your campuses that you may be able to tap or utilize in additional ways, new ways, creative ways, but also then beyond, to think about what's available out in the broader community. And very often we fail to really connect those two things together, because and then we miss an opportunity, because looking in all of these areas is going to be critical for meeting all of the needs and being able to support a continuum of care, both for your students and for your staff and colleagues in that way. So just want to put that in your brain as something to really be thinking about when we're thinking about identifying and accessing resources. The other piece that we always want to be aware of is that once we identify these resources, we really have to figure out how we can utilize them in a way that is going to be sustainable. So sometimes there's finances that are a reality. Is this a resource that requires funding? If so, how can we sustain funding for that? is there a creative way to look at how to support that? Is this a resource that requires time? And when this kind of emergency crisis situation passes, are there going to be is there going to be the necessary time allocation from certain people available, or will they have to return to other duties and other priorities? So really thinking through not only what the resources are, how we can use them now, but how we can also sustain that utilization and make it sustainable in that way. So, you know, a seemingly simple task, and there are lots of ways to do this around resource mapping and identifying what's available in different parts of your community, and you know, and matching that to your needs assessment, and thinking about, again, what are the data sources for what you have? Are you sure you know about all of the behavioral health resources in your community? Is there somebody who you can tap to make sure that you've identified all of those potential resources? And then know, how can they be available and accessible to your students or to your staff in that way? Just one other thing that I would say, again, just to make sure I don't forget to say it later, but one resource that, you know, we know has been critical for staff are employee assistance programs. And we know that everybody has them. And yet I'm astonished when I go around and I'm talking to all kinds of agencies across the state, how many staff actually don't know that they exist for their organization, their agency, or their institution. And, or if they do know about them and they know this idea of an EAP, they're not exactly sure what they're there for, how to access them, or they're very concerned that they're not going to be confidential, or that somehow it's going to be connected to their personnel file. It's going to reflect badly on them. So there's a lot of hesitancy around utilizing the services. So just that's one area of service that you probably already have. But when you think about, are people able to use it? Are there perceptual barriers, or are there structural barriers that are keeping them from using that? What can you do to break down those barriers and make sure that folks know that that's a resource that they have as well? Melissa, do you want to add anything?
Nope, I'm good.
Okay. So we also just want you to sometimes think in a very strategic way. So sometimes thinking about how to meet this kind of big ball of wax of need around mental health can feel overwhelming, particularly if you are not a mental health professional. And so you think, oh my goodness, where do I start? And one of the things that is a really strategic way to think about this is to take a public health approach to the continuum of supports for students and for staff. And what we mean by that is to really think, what does everybody need at the universal level? And that's things like basic education, and reminding folks that what we've been through for the last 12 months is not going to leave us unscathed, that it makes sense that we are reacting with maybe very strong responses, emotionally and psychologically, cognitively and physically. And that doesn't mean that there's something wrong with us, or that we're not strong enough, or that we shouldn't be doing our job, or we're not cut out to be a college student. It means that the stress has been really enormous. So normalizing that is something we should be doing across the board for everybody, because that's part of what creates that expectation of, we don't expect everybody to just be rocking and rolling through this. We expect that we're going to be stumbling, and we have some supports and resources to give you, to offer in that way. Prevention resources. So what can we be sharing with our students and our staff to make sure that they know how to maximize their coping, and what are the things that will be helpful, and what's available to help them to do that. Reminding them that it's not always about mitigating the damage that we're feeling or the negative impact, but it's also about continuing to build the strengths and the positive side of the equation. So what can we be doing as a whole for our community, and what can we help individuals to do for themselves, regardless of whether they seem to quote unquote need it or not, right? That's kind of like, that's for everybody. That everybody should have that information. Some schools and universities are looking at, should we be doing some universal screening to help, again, normalize this, that, you know what, there are going to be times of stress and that not everybody's going to be doing okay. And here's a way to help understand, what do you need? And then to connect those screening outcomes to services and supports. So that universal level is for everybody, and it's a great way to start, and it's a really, really critical piece, because the other two levels of supports only really work and are effective if they're grounded in a strong universal culture that is saying, we get what this means, we get what's happening, and here's what we think everybody needs. Now, when you do that, whether it's just raising awareness or doing some screening or offering people some screening tools, then people who do have some additional needs will hopefully bubble up to the surface, so that either you can recognize them through observation, or they will come and seek additional supports. And so that's where you want your targeted supports and services, so that you can do some early intervention and you can offer some small group supports or some brief therapy responses that can help people manage in that moment, and fairly quickly, hopefully, feel like, oh yeah, I know what I need to do now. I'm feeling like I can handle this. It may not be feeling all better, right? That's not necessarily the goal, but it's to beef up and support coping strategies so that they continue to engage in the learning and the community in the ways that they want to, and that you as their learning coaches need them to in that way. This is also where we want to build up ideas around peer supports and peer monitoring, both again at the student level and at the staff level. And we're really going to pay attention to equity issues here, to making sure that everybody has access to the services and the supports and can utilize them. Not just that they're equally available, but that they're equitably accessible and available. And then finally, for folks who need a more intensive response, that's where you're going to offer your psychotherapy, your individual therapy, your more long-term group counseling, and accommodations. I didn't mention accommodations at the targeted level, but that's where they should probably start as well. So one of the errors that we sometimes make is that we start by thinking about our services and supports at the intensive level, when actually we really need to put a lot of energy into that universal array of supports and services, because that's going to maximize our efforts and hit the most people and enable us to really identify who needs are targeted and intensive. So just wanted to point out that that's a way of organizing your thinking. Anything you want to add, Melissa?
Yeah, really more of an example in terms of universal supports. Something that the EKU Counseling Center has been fortunate to do is to partner with our Department of Human Resource, our Human Resources office here on campus. And what we've been able to do is to partner with them and offer QPR suicide prevention training as part of new hire orientation. And in fact, one of the folks on this call, Dr. Laura Vance, has been one of the biggest champions for that. Before Human Resources put that into place, she was ensuring that every one of the people that work in her office go through that training. And it's something that takes an hour once a week. We offer it to new employees, and yet what it is doing in terms of allowing us to expand the safety net around our entire campus community it's an amazing thing to try to think about measuring prevention, but that's part of our goal.
I think that's a great example. And for those of you who are in the secondary world, QPR is great. And also youth mental health first aid is available. There are trainers available through the Kentucky Department for Education. So if you don't know about that, happy to connect you on that similar benefit in that way. Yeah, great. So Melissa, I think you were going to talk a little bit about what you guys are doing as an example before we move into our breakout groups.
Sure, I'm sorry I jumped a little ahead there.
Yeah, it's perfect.
A couple of other examples that I'll just briefly share. One involves a partnership between the Counseling Center and our Office of the Center for Student Accessibility on campus. On other campuses, sometimes that's referred to as the Disability Resource Center or Disability Services. And one of the things that we do is we offer a support group called Ready and Able. And it is a drop-in support group for students who have chronic health concerns and or who have disabilities. And we are allowing the students to self-identify if they fit into one of those categories. And by doing it as a drop-in group, it doesn't require the student to otherwise be affiliated with the Counseling Center. And CSA, the Center for Student Accessibility, has been, again, a huge champion of helping students know about that resource and helping them to get connected with it. One other thing that I'll mention just very quickly is thinking about the menu of services that are available. Again, not thinking about that intensive intervention, but thinking about that universal intervention and what we can make available and make accessible to as many people as possible. During the pandemic, we rolled out a 5-part workshop series called Peak Performance. Organization and action is one of the modules that's offered every week. So for students who are struggling to get started, that's the momentum. The other modules include goal setting, motivation, performance anxiety, and burnout. And that's something that students need at any point, and thinking about the nature of virtual learning and the self-directedness of it, we felt like those workshops would be particularly important. And when we looked at students' concerns about their academic performance, that seemed to be a natural fit with some of the data that we had.
Great. So since we don't have that many people at the secondary level, I will just share a few. We had put together some examples of what's happening at the universal, the targeted, and the intensive levels, so ranging from adapting things that were happening for the virtual world to recognizing, the need for more supports during learning, brain breaks, and self-regulation tools that are integrated into the day, to proactive outreach and education and raising awareness for not only for students and families, but also for support, to a very similar approach at a targeted level of having drop-in times and drop-in groups. But again, initially they were focused for students, but there are several districts that have opened them up and provided family drop-in times, which is really critical. I mentioned the idea of making sure that folks are aware of and using EAP and know how to do that. One district actually set up their own kind of internal crisis line where they utilize the behavioral health professionals within their district. This initially was set up right at the beginning of pandemic in response to, unfortunately, the loss of 2 students in a car accident. And they realized that because they weren't in school, they didn't have eyes on the kids to be able to see how they were reacting. So they set up this support line and then decided to keep it going. And they just used a Google number, and they forward the Google number to one of the behavioral health specialists. And initially last spring, it got a lot of use. It has tapered off some. They've seen some kind of ups and downs over the course of of the year. But that was an innovative, pretty simple way for them to offer a support. And then when they saw it, that it was useful and being used, and even after the initial calls in response to this loss of students started to wane, they saw some usage in other areas and were able to continue it. And then, of course, transitioning into being able to convert some of the face-to-face services that they used to provide to telehealth services. So we have brainstormed some innovations that folks are using and that we wanted you to think about. We'll just put, these are kind of seeds for you to think about as you get into your breakout groups, which we're going to do in a minute. But one of the pieces is that there has never been a time where the need for psychological safety on campus, in classrooms, in any kind of gathering, virtual or in person, has been more apparent. And so I think for those of us who've been talking about psychological safety for a long time and sometimes met with glazed over eyes, this has been a moment, an opportunity to seize, to say, you know what, we have to make sure that people are feeling safe and feeling comfortable, because we know that they can't really learn or engage in executive function activities until they feel safe. And as part of that, we have to make sure that our staff is feeling psychologically safe too, which means, you know, making sure that we're checking in and helping to support their resilience because of this parallel process that we know happens between the supporters and the students in that way. We also have noticed that we have to kind of shift our focus where we've maybe been very content oriented around what are people actually learning, that during this time we've really had to really focus on the whole student and focus on resilience building elements, including social and emotional learning, and that we are building that into the process as well as the content. We've talked a little bit about screenings. Some other things to think about is making sure that you have your students' families and then also your staff voices as part of the solution seeking team. So making sure that those voices are included, they're at the table from the very beginning, they're helping to weigh in on development of practices or any policies that will impact them, and really talking about what it will feel like from their perspective. We need to use multiple methods of communication and constantly be using those multiple methods. I think if, again, what we've learned is that some students do better when they're texting than when they're talking to you, or when their camera is off rather than on. And so just because we can be in person doesn't mean that we have to stop using those ways of checking in with people that may be more comfortable and elicit more of a response. And to, you know, making sure that we're following up with those students who we have lost touch with, who have not been connected to us whose connections have seemed tenuous in some way. So being proactive about that. I think, you know, from a university perspective, there's a lot to do, and sometimes it's hard to follow up. And we even see this at the secondary level, but how can we do that proactive outreach? And then, of course, partnering within and beyond the organization. So what we want you to do during our breakout groups is to really try to work together and think about the seeds that we've planted and talked about and maybe rekindled in your heads, and give you a chance to develop a plan. So there should have been a sheet that was shared. Beth, I'm not exactly sure how you shared that sheet for the breakouts. But what we want you to go through is do some quick introductions, start a list of your resources for yourselves individually just for a minute or so, and then really start brainstorming together around innovations, around how you can address what your needs are, whether those are data needs or resource needs or planning needs. Learn from one another. We will be rotating through and popping in to support you as you do this. And as you brainstorm what might be possible, to then think about, okay, what could we actually do? And what could we actually go back tomorrow and do? and identify your next steps. And then we will just come back for a brief moment before we go back to the main group, the big webinar. So Melissa and Beth, anything that you want to share?
Yes, so I'm gonna take over the screen sharing really quickly here.
Yep, perfect.
And tell me if you guys can see my screen.
Not yet.
Not yet.
Okay. Let's see. Share.
There we go.
Okay. Well, let's put what you need over there. How about that? Okay. So as Miriam said, you should see in the chat box the link to 2 files. Can you guys see that? Feel free to unmute, say yes, no. I can't see the chat at the moment, so.
Yes.
Yes.
Okay. So if you hover over those, you should be able to click on it and open that up. If someone would test it, I would appreciate it. If not, I have an alternative and I can share it through a Google Drive link. But what you're going to do is you're going to want to download both of those files from the chat. One of those is a note taker worksheet and the other is an individual worksheet. Miriam and Melissa have put together a list of questions very specific for you to answer to help you through this conversational process in your breakout rooms. Once I activate the breakout rooms, you're going to choose a room based on the affiliation that best represents the work that you do. There are 3 post-secondary rooms, and there are 1 for middle school, high school, and other. So please select the one that is most closely aligned to the work that you do, understanding we can't fit, everyone, right? We want you to have partners to discuss with and bounce ideas off of. Once you're in the breakout room, someone is going to get the lucky job of being a note taker, okay? Please make sure that someone is assigned as note taker. And the reason for that is when we come back to our session in this group, you guys will kind of share out what the highlights were, and then I'm going to ask you to upload those notes then to the chat files. I'll put the instructions back on the screen when we come back together on how to do that. But the reason that we need to take a few moments to do that is when we all leave to go to the 3 p.m. session, I'll be sharing out the highlights from your breakout sessions to the larger group. So while we all will be going from group to group in the breakout sessions, it'll be helpful for me to have those in your notation form. So if you need help while you're in the breakout rooms, there is an option to click ask for help. I will receive the notification for that, and I will be on my jolly way to provide any assistance that I can, okay? So we'll return from the breakout rooms at about 2:45. We'll take about 10 minutes to share out the highlights from each of your breakout room conversations. And then I'll share with you then the link, which you already have, but I'll share it for you easily also so that we can join the main session with all of the other forum participants at 3 p.m. Does anyone have any questions before I activate the breakout rooms? Was anyone not able to download the files? Okay. And hearing no nays, I'm going to activate the breakout rooms. You guys will be able to just choose your own room.
Hi, can you resend the files, please?
Yes, ma'am. I think I need to do that before you join a breakout room. Let's see. Give me just a second.
So as Beth is doing that, I'll tell you, we probably won't pull you back until about 10 of 3. We'll give you a little bit more time. And the time allocations, are fuzzy. You can adjust as you need to. Just try to get through to the point where you're actually doing some planning and not just talking about what you could do, but actually thinking about what you can actually do yourselves. So, and we'll float through in a minute as well. So if you can move your chat up, you should be able to see things that say the path forward. There are two from the Kentucky Virtual Library. Oh, there they are. Perfect. Okay, so she's putting them in
Okay,
Google
can you
Drive.
see them in the chat? If not, I also loaded the link to the Google Drive that has those documents in there also. Whoever asked that question, are you now able to scroll up and see those?
Yes, thank you.
Perfect.
Excellent.
Okay, good.
Okay.
All right, so we'll come around and see you in breakout rooms.
And I'm initiating those again. One moment. Okay, technical issue. For some reason, I'm no longer seeing the breakout room option. They were there and now they're gone. Can you guys see them, Miriam?
Yeah, I
Yes?
see them.
Okay, I can't see them on my end, but if you guys can, then we should be good.
So I don't know how to initiate them. I see them, but like when I hit it, it's not giving me a. I see that some people have joined.
Oh,
Quite
there
sure.
they are. They just showed up again.
Okay.
Okay, so I have a few people who are unassigned. If you guys will join a room, or I can assign you to a room. Okay.
Bob, tell us about what you do. Oh, he joined a room. Perfect. Okay.
Yep. Okay.
Got it.
I think everyone should be in a room now.
Yeah, it's
so-
just the three of us left.
Yep.
So, boy,
You want to
are-
give them a few minutes to get started before.
hey,
popping in?
Beth,
Yes,
were
ma'am.
you in touch with anybody else? Did they have much lower attendance today than they
I have
anticipated?
not. I've not. No one has.
Because you know that's we had
messaged.
such low attendance based on what they had projected.
Yeah, what we had predicted. So.
I mean,
Yep.
and sorry that it took much longer to get through all of that. I don't know.
Oh, not at all.
I'm sorry if I was, if my.
No, I
cat-
think it was all good and relevant information. It gave them plenty of context to have their conversations going into their breakout sessions.
I hope so. I mean, we lost a lot of people during the time, so I felt a little bit badly that maybe it didn't address what they had hoped it was going to address, but and it was clearly billed as a, as a planning. I don't know.
Okay, so I'm looking at the room numbers. It looks like Bob is in a room by himself.
Yeah, is there a way to move him to?
Yeah.
But I have 1, 2, 3, 4, 5, 6, 7. I have 8 in post-secondary room 2.
I mean, if,
Can I move Bob to room 3 or room
Yeah.
1?
Yeah,
You're gonna move him to room
honestly-
1, and that puts 3 in that one.
I mean, honestly, I'd be fine if all the post-secondary folks were just in one room and it
Yeah,
was.
you could put them together. Yeah.
I'm fine if it's just one room.
You want to you want to go in and tell room 1 that we're going to move them all to the other one so they're all together, and then you could go do that one and I'll go to the other room.
Yeah.
You could go to the post-secondary and I'll go to the.
Yeah.
Okay.
Okay.
How do I enter?
So can you see the breakout room box?
Yes.
And does it
It
say
should
join?
say join beside of it.
You can join up where it says post-secondary room 2 over to the right should say join. You should be able to then join that room.
Oh, there we go. Okay, yes.
Yeah.
All right,
So
so-
are you gonna let them know?
You want me to go to room 1 and tell them?
Sure, if you don't mind, that would be
Okay.
great. All right. I'll see y'all in a bit.
Okay, so I'm going to go to room 1. Hey, Melissa, I'm going to let you open up.
All right. Well, I was with our post-secondary group, and there was a lot of very good discussion. And as such, we had a harder time getting to the task parts. And the group did a phenomenal job with that. Clark was our scribe and is planning to be our reporter. And so I will turn it over to Clark.
I'll even try to unmute myself before I start talking. So one of the things that was common throughout our whys was talking about kind of that personal connection and either serving students or having personal connections with people who struggle with some of these issues and wanting to find resources. Things that we discussed in terms of brainstorming, we talked about mental health first aid, which is a specialized training that's available for faculty and staff on campuses. And it's something that CPE has offered funding for the universities within Kentucky. It's an 8-hour session that faculty and staff can sign up for. So some institutions are taking advantage of that. We talked about coordinating with first year experience office. So kind of working with those students early on. I know it was mentioned that they've done QPR. I think it was EKU has done QPR training earlier on in the first semester for their freshmen, and that has shown an increase in usage of their counseling services by freshmen, and then looking at cohorts in those data as well. We also discussed connecting better with community services. So not just looking at the students as their identity pertains to their connection with your university, but looking at nonprofit orgs and services offered in the larger community as a whole. This is one of the advantages we have with NKU being so close to Cincinnati. There are a lot of organizations we can connect our students with outside of just their connection with NKU. And then increasing resource literacy. So creating kind of an answer sheet for whatever problems students may be facing and sharing that with faculty and staff. One of the concerns we had brought up was maintaining the currency of that list and making sure that it's kept up to date. That can be difficult as shifts happen on campus all the time. We're aware of that. But something like that to share with faculty and staff. And then also, oh good, we've got the link for mental health first aid. Perfect. And then working with faculty orientation and gatherings as they have them throughout the years to talk about mental health training. Because we talked about how sometimes faculty aren't as in touch with some of the mental health concerns that our students have. For instance, faculty being shocked that a student would be kicked out of their home and be possibly living in their car for the semester. And that's something that I think many of us on this call know happens and work with those students. And then we also talked about the diversity of counseling staff on our campuses. So making sure that not only do we have adequate numbers of counselors available, but adequate diversity in that when our students meet with a counselor, they can meet with somebody who has an understanding of what that student may be facing based on different identities that they experience. In terms of brainstorming, we talked about conducting a SWOT analysis. So kind of wherever you're at in the process, beginning out with a SWOT analysis, which is strengths, weaknesses, opportunities, and threats, to establish where you need to start moving forward, because it's not a problem until you have a solution. And if going to administration is your next step, you want to make sure that you're presenting the possibilities to them. I think that was it. Team, did I miss anything? Okay, perfect. That was our group.
Great. Well, we were a small group and an unusual group in that everybody in the group was actually one of the resources that provide services to schools. So one of the big barriers that was identified is we can't always determine how we can get in there. So we were talking about some creative ways, brainstorming some creative ways to connect with particularly students for whom their level of engagement has shifted over the course of the year. And so Beth, you were kind of our note taker. I am happy to let you talk and let everybody else chime in or however you want to do it.
I mean, Caitlin or Tiffany or Quenisha want to, kind of talk about some of the high points. That's fine. Just quickly, we got about 5 minutes. So I am going to Clark, if you'll please load those notes to the chat.
I see Tiffany shaking her head, so I don't mind just speaking really quickly. But I just wanted to say that I was really grateful for our small group. We were small, but we didn't talk as much about resources that we had, but we did have a safe space to just discuss the problems that we've had, and get some stuff off our chest and be able to make connections. And I'm really grateful for that in this virtual world. But I think one thing that I want to work on next steps is looking more into how to address these virtually over the summer, how to address mental health, and then find more ways to communicate with students that they actually want to communicate through. So that's something I plan on reaching out to some coworkers and also to some of our students and see if I can get some student voice in there and help me fix all of my issues. Let's get a kid and get them to help me, because I'm not doing it by myself. But I'm really grateful for the breakout session. Thank you, guys.
The only thing I'll add is we talked about the importance of meeting students where they're at and whatever that platform is to engage them, and that there tend to be bureaucratic things in place that may prevent us from reaching across to our students, even though we know they're there, we see them, we see the need, but we can't actually bridge that, especially for those of us that are external providers. So while we didn't get to the planning part, I would think that one of our next steps will be having our conversations with our partners to say, how do we build a bridge here, right? How we identify, we see it, how do we get to them? And then another thing that we talked about is the fact that while we're all trying to be positive and we want to present that to our students, it's also important that we do respect where they're at and give them the space to get the negative out, right? You don't have to focus on it, but they also shouldn't be internalizing and keeping it all in either. Sometimes they just need to complain the same as we do. So acknowledging that those conversations may not always be positive, right? It may be negative, and that's part of good mental health, right? Is being able to vent out the negative and then work toward a positive and a solution. But you also have to be communicating both feelings. So.
Yeah, and I think that we talked a little bit at the very end as we were getting cut off, but about the idea that that even though we feel like we have a lot of business to get to, that's really important for the students, that sometimes you have to start, whether it's students or parents or faculty or staff, you have to start with a moment to check in and a way to down regulate to be able to get to any of the business. And without that, then nobody is able to really engage, and how important that is for all of our well-being. And it creates that sense of community and the fact that we do care about and for one another, which is part of what starts the ability to address the mental health issues.
So thank you to Melissa and Miriam both for leading these discussions. I think I know that I feel better about where we're at and where we're going. Even if we didn't get through the whole list of worksheet, right, that was intended. You do have those tools to use in your conversations moving forward. And I'm sure that if needed or desired, that both of them are open to accepting your questions through email. And I'm following up with you in that way. So we do need to go join the 3 o'clock larger session. I put the link to that session in the chat. And Clark, thank you very much for the notes. I appreciate it. You guys have a great day.